welcome back. And we're moving into our second conversation for today as we find out more about the National Nutrition and Iodine study that is about to be rolled out through the schools. We have with us, representing the Ministry of Education, Nelma. We have in the middle Dr. Michael Zimmerman, who is the head of Human Nutrition Laboratory at the Swiss Federal Institute of Technology. And of course, you're the consultant heading up the study. And on the end, we have Nutritionist for the Ministry of Health, Robyn Daly. Good morning and welcome.
Thank you.
So I think one of the first questions is obviously looking at the assessment of the nutrition of our children and just where we are in terms of what we do know so far. Let's start with that, Robyn.
Well, our children, when we're looking at under 5, that's where we have most of our statistics. We're looking at mostly undernutrition, which would include some nutrient deficiencies, anemia. Mm-hmm. We also have like low weight for age, underweight, and we have stunted growth. So those are some of our common factors as we look at undernutrition in children. We do have some cases also of obesity, but not as much. We have more undernutrition in our country with our children.
Why undernutrition and not malnutrition? What's the difference?
Well, malnutrition is the general term.
Okay.
So, but malnutrition encompasses over and undernutrition. So
okay.
It's the two, but we focus mostly on undernutrition because that's where we have most of our challenges.
Why is it important that we are able to know the level of nutrients that children are having?
Well, children need nutrients to grow, so and our children are the future. So we need to have an idea what to feed our children, where are our challenges, what children are deficient in, so we can do better planning so they can learn, so they can thrive, so they can develop properly.
Yeah, yeah. Now, Nelma, we know a part of this is what has prompted the Ministry of Education to even move into feeding programs and even institute some of the health drinks. I think there was at one point in time within the schools. Talk to us about that.
And in addition, we do have it in our curriculum.
Yes.
In terms of nutrition, teaching them the basic information. Like she so rightly said, a large number of our children are on the nutrition, and so the Ministry of Education has instituted the Southside Meals program, feeding about 750 kids on Southside. In addition to that, we have the Belize Rural Primary School, which feeds 190 students similarly. And the meals that are prepared are guided by nutritionists such as Miss Daly. On a daily basis, there will be meals outlined specifically as what they are to get, a balanced meal prepared for them, inclusive of natural juice and fruits, serving of fruits per day.
Yeah. Now, Dr. Zimmerman, let's talk a bit about the work that you do and how you were recruited to participate in the study here in Belize.
Yeah, so the main focus of my research and my activities worldwide is on iodine nutrition specifically. Yeah. So iodine is one of the micronutrients that are present in foods that are critical for child development, particularly brain development. So we were involved in a regional study, a Caribbean study, which is sponsored by UNICEF and the Pan American Health Organization, and we were very happy to hear that Belize was also interested in participating. Yeah. So along with 8 other Caribbean countries, Belize is the 9th country to participate in the study. Mm-hmm. So we're using standardized methods throughout the Caribbean to assess iodine intakes in primary school children. And we're here in Belize the next 2 weeks doing that.
From a general point of view, what is the importance for having iodine and consuming iodine as a child or as an adult?
Right, so iodine is one of these critical micronutrients which is essential to get from the diet, because if you don't get enough iodine in your diet, it causes your thyroid gland to function very poorly. And if your thyroid gland is functioning poorly, it affects all parts of the body. So, for example, a woman who is pregnant and iodine deficient will have a very poorly developed baby. Children who are growing up who do not have adequate iodine, so they don't have adequate thyroid activity, will learn very poorly in school, have a decreased IQ. And adults with low iodine intakes will have fatigue, tiredness, and very poor work productivity. So it affects many aspects of the body, but the one we're particularly interested in this study is that it affects the ability of a child in school to learn.
Now, what would be common sources of iodine in someone's diet?
Yeah. The thing that's unusual about iodine is it's present in only a very few foods. So it's present in most foods which come out of the ocean. So it's in fish. It's in many seafoods like shrimp, things like that. It's present in high amounts in seafoods, but it's not present in high amounts in any other foods. And particularly in Central America, the fruits and vegetables and foods that are grown on soils here are low in iodine. So the other major source of iodine after seafood is actually iodine which has been added to salt.
Salt, iodized salt.
Yeah.
That's interesting. But why did you find this to be a necessary area to dive into, to find out more about? Is it because we're seeing iodine deficiency in other parts of the world, or only now recognizing the effects of iodine deficiencies?
Well, the focus on the Caribbean region, including Belize, has been because many of the other countries in Latin America have demonstrated iodine deficiency in their countries and have developed programs to correct iodine deficiency, usually through introduction of iodized salt or encouragement of consumption of iodized salt. And the Caribbean region, including Belize, has lagged behind a little bit in getting data on iodine intakes in the population that will inform a good program. So that's why the focus is on the Caribbean region, including Belize now, is because we really want to ensure that children in this region are getting adequate iodine in order to allow them to, do well in school and overall benefit the country.
Is it a case where, while, for instance, Belize City and other coastal communities may have access to, you could eat a fresh fish every day if you want to, but someone who lives further inland and it lives away from a river or somewhere where you could actually fish, don't have access to fish, and perhaps they don't purchase the kind of iodized salts that would allow them to have that in their systems, that they would probably be more susceptible to this deficiency?
What we are grateful for is having this study done, so we could use this as an opportunity to educate about iodine. And as Dr. Zimmerman mentioned, seafood is one of the largest sources where we could get iodine, but there is also in some foods other than seafood. So that's also a part of the education that we want, not in high amounts, but still. For example, in milk, in eggs, in other types of fish, and also in some fruits, not in high traces, but it's an opportunity also to educate. And of course, we don't make our own salt here in Belize. So when you go to the grocery store, you have that option to select plain salt versus iodized salt. It's an opportunity also to educate people, iodine is a necessary nutrient. You should be picking up that salt that has an iodine in it. So this is also an opportunity to promote also iodine in the diet and where they could get other foods other than, seafood if they don't. Because even though we take it for granted that people have, we are surrounded by sea and people, we have it available. Many people don't.
Well, I was going to say, let's
it's
take
kind
a
of
poll
expensive
here.
at
How
some
often
cases.
do we have fish?
Exactly. So it might be once every 2 weeks, or something like that. It's not something that some people of course have it often if they gain they make a living from being fishermen or that kind of thing. But many times in our basic diets, it's not something that we have often. And we do have seasonings that we use, and it might not be iodized salt that we're using for a seasoning. So it's a good opportunity to see where we are, where our children are as it pertains to iodine. And it's an also opportunity for us to do education and promotion.
What would be some of the effects of iodine deficiency?
Yeah, so, it depends on the severity of the iodine deficiency, right? So what's been shown around the world that if you have very severe iodine deficiency, you develop a goiter, which is an enlargement of the thyroid gland. That's the classic sign of
That's
severe
the
iodine
mass
deficiency.
that would come under here?
Yeah, that's
Okay.
right. So it's a painless mass at the base of your neck. It's very common in countries where there's very, very low iodine intakes. Now, iodine intakes in Belize and in Central America are not that low, so there's not goiter. However, more mild iodine deficiency that is not severe enough to cause goiter is still severe enough to affect
Brain.
IQ. So in areas where there's even mild to moderate deficiency, where there's no visible goiter, you can still have decreases in IQ in school children. That's been demonstrated all over the world.
Is it a matter of brain development that it affects?
Yes, well, if it's early in life, so if it's in utero, in pregnancy, or in early infancy, it does actually affect brain development because thyroid hormones are critical for normal maturation development of the brain. Later in school children, it's not so much development anymore because their brains are formed, but it's how well the brain works. So it's basically the activity of the brain, how well it processes information, concentration, memory. All those things can be affected by mild iodine deficiency.
That's very interesting.
I am glad that he said that because we are having a challenge as we speak in getting our parents to participate and give consent as to doing the actual test or the survey. And so the importance of what he's saying is critical for our general public to understand why we undertake studies like these.
Yeah. So essentially, I mean, this is so important because if your child has perhaps been having challenges in school or has difficulty paying attention, the teachers say that, and you do this test and you find out they're deficient or lacking in sufficient iodine, that may be a part of what can help. Is it reversible?
It is. That's what's so nice about it is that mild to moderate iodine deficiency at school age, if it's corrected, for example, by increased use of iodized salt or increased consumption of seafood, it'll rapidly reverse the abnormalities in thyroid function and IQ will actually increase. And that has been shown in many well-done controlled studies that if you increase iodine intakes, you can actually improve school performance.
So
You know
as
many
a
parents
child-
want to go feed their children fish now?
Can supplements work as well, right? So
Yeah.
vitamins that contain iodine, that's another method
Right.
that could work in addition.
So
to
as a
the
child or as a student, you're always taught or reminded that breakfast is the most important meal of the day because it allows you to get through your sessions at school. However, if you have breakfast but you're not really consuming the balanced diet that includes iodine, then doesn't that to an extent also kind of, defeats the purpose of eating a healthy meal and being able to learn and retain as you go along?
That's a very good point you brought up, which goes back to what Ms. Mortis mentioned about having a nutrition plan or guide in terms of what we give children in schools, and not only for the school meals program, but generally as part of education, even with in our clinics in terms of complementary feeding. This is why when we have our sessions, we try to educate on what are advisable foods parents should be giving their children, because it's not, remember 0 to 5 is a very critical point, and it's not only about giving food for the child, it's also providing nutrients that the child needs for growth and development. So that's where the education comes in with, not just giving the child something to eat, biscuit, junk food, whatever it is, but it's to provide nutrients that the child needs for growth.
Yeah, absolutely.
And that's interesting because I think when we feed, we just feed to give a meal to satisfy hunger. But in terms of that critical period from 0 to 5 years, that's when the child needs the nutrients the most. And it is something that we have to continue push forward so that, again, parents do understand that that's a critical time for brain development.
But even as a non-parent, I know that that's also the hardest time to get children to eat regularly. It's like coaxing and bribing to get them to consume food, even more so food that would be good for them. So I think obviously you want to be able to, I remember Robyn talking about developing the right palate from a young age so that they would be more open to other foods.
It would be interesting though to see the outcome of this this study, because I believe, because we are Caribbean, we have the sea nearby, we have a lot of fish, we have a lot of the seafood that should provide that nutrients.
Yeah. We will see. But I want to get to, because you mentioned that parents aren't signing up for the study as much as you would have thought. So let's talk about how you plan to conduct it in the first place. What age group are you tackling? What areas? And what would the test entail?
The age group is 6 to 12 years old.
Okay.
The test entails where we're doing basic anthropometry, which is height and weight.
Okay.
And then we're also collecting a sample of urine. And I think this is where maybe there might be some concern because the urine is collected on site, right? Dr. Zimmerman,
Right.
it's collected on site. And I think maybe that might be a little factor that parents might be like, you know,
What do you
concerned about. It's not something that they take home and they bring back to school. It's really done on site at the school.
Okay.
So with that, it's just really that, but it's not invasive. It's something that we have health professionals, we have trained personnel that will assist the teachers. We invite parents to come or guardians if they would like to come and view. But it's such a very important test for us as Belizeans to know for our children that we want to have the support that we need, because it will help us to look at further interventions needed for Belize as we look at iodine. And it's also, this is the first study that's being done for Belize.
Yeah.
So really we have no idea, and we are curious. I mean, we live by the sea, we are Caribbean, we want to know where are we? And this is our first study, so we want to have the support. So we are encouraging parents. It's nothing to be afraid of. You know, everything is
So
it's
parents
standardized
must
procedures.
give consent. Yeah.
Well, they have to, since we're dealing with children, underage
It's
children,
ethical.
they have to.
And what schools are you targeting?
We have St. Ignatius from Belize City
Okay.
and All Saints,
Okay.
Belize City. And then we have Corozal, we have San Narciso, and in Dangriga we have Gulisi.
Okay.
So you're trying to cover as much of the country as
I
possible.
noticed we did all the coastal.
It wasn't intentional. It was just the way how our protocol was set up, because the schools were randomly selected. So they were based on clusters and also looking at the enrollment size of the school. So that's how they were selected. So it was out of a number, a
It would
list.
have been
Interesting to see
a
inland.
sample from inland.
Yeah. And there are cultural differences too, because
Yes, because the Garifuna does eat a lot of
fish. Yeah.
So we will see based on that. So I think it's a good representation for the country looking at that, because it's only 480 children we're looking at, a little bit over 400. So with that, we could get a very good idea, and looking at the geographical location, we could get a good idea to see really
How children.
how this study will turn
Then
out.
what happens afterwards? Because while the study is one part of an exercise, once you're armed with this information, then what takes place
That's
thereafter?
the Ministry of Health.
Well, it's going to be a promotion for us, depending on what the results say, because as Dr. Zimmerman mentioned, mild to moderate deficiency can be corrected, you know, with adequate treatment, supplementation, promotion of iodine-rich foods or iodized salt, etc. If there's a lot of severe deficiency, we will have to look at what would be the best approach for that. But of course, supplementation and promotion of iodized-rich foods will happen, and it's going to be something that we promote nationally, not only for the areas that we see deficiencies, but it's something that we want to start promoting as well, because you don't hear a lot about iodine. I mean, there are many nutrients that the body needs, and we don't hear a lot about the micronutrients that we need in small amounts, but necessary anyways for development. So we have to start doing more promotion in terms of nutrients, which goes further to what we are doing this afternoon. So we will be having a seminar just to educate on micronutrients and for iodine and brain development for our stakeholders. So we could start the promotion there to actually look at why do we need iodine, what other nutrients the body needs, where do we get these foods from, the sources, because people need to hear more about this, especially if you have young children. It's something that they could learn from and they could start to implement.
I can recall as a child, they got me to eat fish by saying you're going to get a goiter if you don't. You know, that's how they got me to eat fish.
That's true.
And because people were more visible with it when I was younger, not as much now. But I wanted to ask what other data you'd be looking at. Is it simply testing iodine levels, or are you also looking at surveys with how they eat, with school functioning, how they're doing in school? Will you be cross-referencing that data at all?
Well, the other data, the other information we're collecting as part of this study, besides besides the urinary iodine concentration, which is the best marker of iodine intake, is we're doing a brief, what's called 24-hour recall of foods that the child has eaten over the last day that are rich in iodine.
Okay.
So we ask specifically about seafood intake, about intake of salty foods, which might contain iodized salt. We ask about milk intake. So we do, in the older children, we ask them it's like targeted questions to get a feeling of how much salt and how much iodine might be in the diet.
Yeah.
And the other thing we do is we collect from some of the children, we ask them to bring into school a small sample of salt from their kitchen at home. And we test the amount of iodine in that. So to go along with the iodine in the urine as a measure of individual iodine intake, we'll also have iodine concentrations in household salt to see how many households of the children in the study are actually using iodized salt. So that will help the Ministry of Health in terms of policy, because if most of the families, for example, if iodine intakes are low in children and many of the households are not using iodized salt, then that would be a simple way of increasing iodine intakes, is to promote the use of iodized salt.
Here's what I find interesting. I think obviously people are a lot more aware of how they eat now. And one of the concerns, or actually multiple concerns, when we talk about non-communicable diseases and we talk about having high cholesterol, or if you're talking about hypertension, it means skipping out on some of the very foods that you're saying is important. Seafood, because you always feel it's going to contribute to your cholesterol levels. And also salt. If you're hypertensive, you're going to stay away from salt, whether iodized or not. How much do you think this may influence what the children may be eating as well?
You brought up some good points. What I think we need to look at is to see, it's not to just overconsume iodine, because you can overconsume any nutrient as well, but it's to make sure that it's included in the diet if it's not. And I think it's more of, if you have options in terms of what you're eating, these are some nutrients you need to keep in your diet. Yes, hypertension is, and we're going to be celebrating that shortly this month, Hypertension Day. But we need to look at consumption of salt as it is. But if you know now that your child or even a family member might be deficient in iodine, it just creates that awareness for you to be more conscious of what you use in small amounts, because the amount of iodine we need is very, very small. It's less than a teaspoon per day. It's a very small amount. So if you weren't using iodized salt before, you might start using now. Even if it might be having, like I said, milk, or actually having certain fruits. We actually have seafood. We also have dairy products. That's common in terms of iodine concentration. So it's just to become more aware of, these are the options that I have to have iodine included in the diet versus not having it. So it's not really to scare people and say, okay, you're deficient, you need to start buying and consuming a lot of iodized salt. But it's just to become more aware.
Make little changes.
Exactly.
But I like Marlene's question, because I think we don't spend a lot of time on primary health care, so that we don't end up with the hypertension and the diabetes and all the other stuff. So if we promote it from very early, and we do a lot of it's primary health care, right? I'm not a medical person, but I know we teach it in the curriculum. The primary health care, where children get balanced meals, and then they don't have to end up like when we are adult looking at what we put in for cholesterol and what we put in for pressure and what we put in for all the rest of things. So it is very critical that we...
So when are you planning to roll out the study?
The study starts this week, actually. Preparations have been underway. We've been working along with this for about a couple weeks now, and so consent forms have been sent out to parents. We have been in communication with the 4 schools, getting preparations for Dr. Zimmerman and his team to go and collect the data, because as you know, we are collecting different types of data, so we need to make sure the schools are ready, information is out, and we're getting the support that we need. So this week we're doing Belize City schools. Next week we're doing Corozal and Dangriga.
All right. So if you're a parent of a child at St. Ignatius or All Saints, San Narciso, Gulisi, did I miss any?
Yes,
those are the 4
schools.
Then you may very well have a consent form going home to be able to find out how your child is doing in terms of iodine consumption.
I know one of the things we need to mention is that you have an extended form for parents to fill out. If parents are having problems filling out that form, they can go to the school principal for assistance in terms of interpreting what is expected on the form. Because I think that is a little challenge as to why we are not receiving the feedback that we are getting from parents.
Yeah, that's good to know, so they can come in as well. And if they feel, if they want to be a part of when the child is filling out the data or providing their samples, they can be there as well. You mentioned that earlier. Well, best of luck. And when do you propose to have the data available from the samples you've collected?
Yeah, the measurements will take maybe about 2 months to do, but I expect that the Ministry of Health and the Ministry of Education will have the data back in about 2 months' time.
All right. Well, thank you very much for coming in and telling us all about it, and best of luck in conducting the study.
Thank you.
All right, we're going to go ahead and take our final break now, and when we come back, we'll have our wrap-up, so stay tuned.